You know, there's this single hidden nerve in your body that's working for you right this second, running some of your most fundamental actions. It's this piece of our internal wiring we use all day, every single day, and we never give it a second thought.
I mean, really, think about it for a second. You've probably had a conversation today, maybe eaten a meal, or just taken a sip of water. All of these incredibly complicated things just happen. They're on complete autopilot. But how? What's actually pulling the strings behind the scenes?
Well, it turns out there's basically a puppet master for your tongue. It's this one dedicated nerve that's orchestrating all those tiny, precise movements. It's one of the real unsung heroes of our entire nervous system.
And here it is, the hypoglossal nerve. This is the 12th cranial nerve, and its job is super simple but absolutely critical. It's a motor nerve, which is just a fancy way of saying its only job is to send go signals from your brain to your tongue muscles. It doesn't do taste, it doesn't do sensation, it's all about movement.
So let's dive in and pull back the curtain on this so-called puppet master. We're about to see how it controls pretty much everything. From you chatting with your friends to just enjoying your favorite food, you'll see its role in your daily life is probably way bigger than you ever imagined.
I mean, just look at this list. These actions are so fundamental, right? Without the hypoglossal nerve, you couldn't form words properly. You couldn't push food around your mouth. You couldn't even really start a swallow. It's just a nonstop, totally essential job.
And here is a fantastic piece of trivia for you. The hypoglossal nerve is the boss of almost every single muscle in your tongue. It controls the whole shebang, except for just one. There's this one muscle called the palatal-glossus, and it actually gets its marching orders from a totally different nerve, the vagus nerve.
And this really breaks down the two teams of muscles that it directs. The intrinsic muscles, those are the ones inside the tongue itself. They're what lets you change its shape, like when you curl your tongue. Then you've got the extrinsic muscles. They're anchored outside the tongue, and they control its position, letting you stick it out, pull it back, or move it from side to side.
So this nerve doesn't just appear out of thin air. To get the job done, it has to take a very specific journey. This winding path all the way from the deepest part of your brain right to your tongue. And its route is incredibly precise. It all kicks off in this command center called the hypoglossal nucleus, way down in the brainstem. From there, it has to squeeze its way between a couple of other brain structures, and then it leaves the skull through its own private tunnel, the hypoglossal canal. Its final destination, right under your tongue, which, by the way, is exactly where it gets its name. Hypo means under, and glossal means tongue. Pretty logical, right?
Now, this is a fantastic little quirk of our anatomy. As the hypoglossal nerve is making its way down, some fibers from the very first spinal nerve, we call it C1, they basically decide to carpool. They literally hitchhike a ride along the hypoglossal nerve because it's heading in the same direction, and then they just jump off to power a few muscles in the neck. They're totally separate nerves, just sharing the same highway for a bit.
Okay, so we know what it does and where it goes. It's all incredibly precise. But what happens when that signal gets interrupted? What does it actually look like when the hypoglossal nerve gets damaged?
Well, the signs can be pretty obvious. Someone might start to have slurred speech, a condition we call dysarthria. They'll often say their tongue just feels weak or clumsy. Maybe they have trouble getting food out of their cheeks. You might even see these tiny little muscle twitches on the tongue. And over time, if the muscle isn't being used, it can start to shrink. That's a process called atrophy.
Now, it really matters if the damage is on one side or on both sides. If it's just on one side, unilateral damage, the other healthy side is often strong enough to compensate for a lot of things. But if there's bilateral damage, so to both nerves, the problems get way more severe. We're talking major difficulty with speaking and swallowing, and maybe not being able to stick the tongue out at all.
So how do doctors even check for this? You might be picturing some complicated, high-tech scanner, but the physical exam for the hypoglossal nerve is actually wonderfully simple. It's pretty elegant, really.
Okay, so let's do a little pop quiz. Imagine the nerve on the right side is damaged. When the doctor asks the patient to stick their tongue straight out, which way is it going to point? To the left or to the right? Take a guess.
It points toward the damaged side. So a weak right nerve makes the tongue point to the right. So why does that happen? Well, think about it. The strong, healthy muscles on the left side are pushing, but they have no opposition from the weak right side. So the tongue just gets pushed over. It's like a classic tug-of-war where one team just drops the rope. And this is basically how it all comes together in a super quick, totally painless exam. First, the doctor will just look at the tongue while it's resting, checking for any shrinking or twitching. Then comes the big test, They'll ask the patient to stick it out to check for that deviation we just talked about. And finally, they'll test its strength by having the patient push their tongue into their cheek while the doctor pushes back from the outside.
So if a doctor does find a problem, is that it? Is it game over? Not at all. The good news is this isn't always a permanent thing. So let's talk about what the path to recovery looks like.
First things first, understanding recovery means knowing what caused the injury. This nerve is pretty delicate, and it can be damaged in a few key ways. A stroke in the brainstem, some kind of head or neck trauma, a tumor pressing on it, or sometimes even as a complication from surgery nearby.
But here is the hopeful part, and it's a big one. Nerves can heal. Especially if it's a mild injury, maybe from some swelling or bruising, function can actually come back over a period of weeks to months as everything calms down.
The game plan for recovery is usually a two-pronged attack. First, you have to treat whatever caused the problem to begin with, but at the same time, targeted therapies can make a world of difference. Speech therapists can help patients retrain their mouths to speak more clearly, and swallow therapists can give them strategies to eat and drink safely, which is so important for preventing serious stuff like choking.
When you really step back, the story of this one little nerve is just a perfect reminder of the incredible invisible work our bodies are doing all the time, completely on autopilot. And it really makes you wonder, doesn't it? What other hidden, absolutely essential systems are humming along right now, letting you live your life without a single conscious thought?